talking about treatment, it all starts at imaging, a biopsy, you have a diagnosis. For patients with early disease, localized disease, how have we moved forward in the management of lung cancer, say, compared to a decade ago?
Well, I would say one very big and important change is the more routine use of navigational bronchoscopy for staging patients. One of the things that we're very careful of when we have an early stage patient is we want to make sure that the lymph nodes are clear. And that can be done invasively, but more and more we're able to do it with procedures like EBUS or navigational bronchoscopy, even to go out and biopsy the tumor.
So CAT scan alone is not enough to determine lymph node involvement?
No, certainly not. We like to have pathology confirming lymph node involvement before we go forward and stage the patient, for sure. So certainly navigational bronchoscopy and EBUS are very, very important and help us as a team decide what's the most appropriate therapy for patients. From a radiation standpoint, some of the technologies that allow us to more precisely give radiation dose to the tumor while sparing normal tissues has allowed us to escalate dose to ablative doses, allowing us to give SBRT or SABR to early stage lung cancer patients who are not operative candidates. This is a relatively new development, and I think that the data has borne out that this is a valid treatment option for patients who are at high risk for lobectomy.
You talked about bronchoscopy, and we know that with CAT scans the imaging has improved, and even with these endoscopes that we use to look into various body cavities, the imaging has got much better in real time. Do you think that developments in bronchoscopy have aided diagnosis, or is it just that we can move faster once we've got tissue in the first place?
Oh, it's, advances in bronchoscopy have definitely aided in diagnosis. It made the procedures more minimally invasive. They're more sensitive, they're more specific.
For patients who are going through a bronchoscopy, what can the patient expect? It's a day case procedure, yes?
Yeah, typically it's a day case procedure. They'll undergo sedation, intubation. Usually they'll need a driver.
And in terms of the developments, we're hearing a lot about moving from chemotherapy to targeted therapy. Do you think that in lung cancer, multimodal treatment, combining different drugs is the way forward?
Certainly in more advanced disease. In early stage disease, patients can typically be cured with either surgery and adjuvant chemotherapy or surgery or radiation alone. Now, one of the problems with early stage disease is there's a significant number of patients who will fail distantly, and we're not able to predict very well who those patients are. So combining certain agents, for example, immunotherapy agents or other targeted therapies may be important in the future, and there's some ongoing early stage trials looking at that, specifically with radiation.